Remember that MBBS course is always a mine. Okay, suddenly you might know that some subject you are feeling confident in, that subject you might land up with supply. So all subjects should be taken in the equal value. Because once you get a supply, what happens is you get a backlog. You have to study again. Okay. So try to attend all classes. It's not that easy as it looks like. Okay, now this is today's topic is levels of prevention. So before levels of prevention, we should know what is the epidemiological triad. So any disease needs this three: agent, host, environment. Okay, without that the disease cannot occur. Usually applicable to communicable disease, but also applicable to non-communicable diseases. So first is a disease agent, which is a living or non-living substance, the excessive presence or absence of which may initiate or perpetuate a disease process. Okay. So the disease can have a single agent, but there can also be multiple agents. So what are the agents we talk about? Bacteria, virus. Name some bacteria. Name some bacteria. Mycobacterium, okay, very good. What else? Name some virus. Any virus you can name? Any virus? Huh? Retrovirus, okay. Talk of something which is now in the news, in West Bengal at least. Nipah virus. Don't go to Nipah virus, okay. So we have virus, bacteria, protozoa, fungus. So then you have three terms which are infectivity, pathogenicity and virulence. Again, this is a question which came in the university exam, bit confusing. What is infection? What is pathogen? What is virulence? Let us start with virulence. Virulence means the most dangerous. Infection means I have the infection, but I don't have any disease. Okay, like I've got a cough right now, but I don't have the disease. Once I get the disease, I may have pneumonia or something else, then it becomes a pathogenicity. Okay. So then you have physical agents like exposure to excessive heat, cold, humidity, pressure, radiation, electricity, sound, all this can be agents. Chemical agents, endogenous agents, exogenous agents. Like right now we are having some air pollution in various parts of India, including West Bengal. So that is causing a lot of cough and other things. Then mechanical agents, road traffic accidents, etc. The nutritional agents, lack of vitamins can lead to a lot of things. Like this child. Can you say what is wrong with this child? Can you see this child and say what is wrong with the child? Just tell me what you see in the picture. क्या देखते बच्चा? क्या देख सकते हो? What? Huh? Malnutrition. Okay, malnutrition. How do you say it's malnutrition? Yeah, how do you say it's malnutrition? Tell me. You said it's malnutrition, you're right. How do you say it's malnutrition? No, it is malnutrition. Anything else? It is malnutrition, definitely. Why do you say it's malnutrition? Huh? Yes, prominent ribs. Very good. Prominent ribs. Prominent ribs could also be a sign of vitamin D deficiency, but we are not going to dissect it. Yes, definitely malnourished. You can count the ribs. Okay. Then social agents, like various things which are there in the community now, like tension and all this stuff, alcoholism, smoking, etc. Then hormones, lack of some part or structure, chromosomal factors, all these can cause disease, immunological factors also. So here we talk about host. Host is referred to as soil and the disease as the seed. Okay. Now demographic factors. For example, some diseases are common in African community, some diseases are common among the Indian community, but they are not common among the, say, Western community, US or Europe or something. So you have demographic factors which are basically geographical factors. Then biological factors like, for example, blood pressure. There are a lot of other factors which involve blood things. Socioeconomic factors, again, higher education, higher money gives you slightly better health care. Okay, so you have chest pain, you have the money, you can go for a bypass and all without any insurance. But if you don't have the money, well, then you may have to wait, you may die, anything can happen. So socioeconomic factors also. So what is the socioeconomic factor on the right side? What is the person doing on the right side? What is the socioeconomic factor on the right side? Right side photograph. What do you understand by that? What is the left side is somebody doing a ordinary job. Right side, what is that girl doing? What is she doing? Huh? What is the impression? Huh? Well educated. She's saying well educated. You agree? You agree? He's saying well educated. Do you agree? Do you agree? Then why am I putting the picture? If she's well educated, why am I putting the picture? Tell me. Tell me. He's saying well educated. Your friend is saying well educated. How many books? 1, 2, 3, 4, 5, 6, 7. 12 books. 12 books. But is that the reason I put the picture? Tell me, Bota. Tell me. Is that person stressed out? She's capable. She's capable of that. But look at the expression. What is she doing? She's studying for the MBBS exam. What? She's got 12 books to study for second MB, final MB, whatever. So she's stressed out, right? So that picture shows stress, not the education level or what was the one you said? Money. Money, something like that. So here is just the stress. See the way she's looking. She's carrying so many books. She doesn't know what to study. Tomorrow is the final MBBS exam. Kahan se shuru karega, kahan khatam hoga? She doesn't know. Okay. So then comes this germ theory of disease. So previously they thought that a particular disease must have a virus or a bacteria to cause the germs. So this was promulgated by Robert Koch and Louis Pasteur. So like typhoid bacillus, tuberculosis bacillus, cholera, gonococcus, everything. But there are many diseases which don't go straight away. Not just one cause, but multiple causes. So this is what Robert Koch said, disease, man, disease. So without a organism, a disease cannot occur. That is what this person, Robert Koch, actually said. Okay. So a specific organism is always associated with a specific disease. Microorganism can be isolated from the body, from the animal and grown in culture. The cultured microbe will cause disease if it's inoculated into another animal. And the last one is that the same type of organism can be taken from the second person and isolated. Okay. So this is what is called Koch's postulates. However, it's not always the case. So why do some people suffer from illness always? Some people don't suffer from illness. Why? What is the reason? Your roommate has got chicken pox, you don't have anything. You're traveling in a train to wherever. Somebody in the train coughs a lot, but you're not getting the infection. You're immune. So this is why some people do not suffer from the disease, even though they harbor the pathogen in the body, as in a carrier state. So that's why this germ theory lost its flavor. They said, now get back to agent, host, and environment. So again, epidemiological triad is not applicable for non-infectious and chronic disease like coronary artery disease, mental illness, because there are multiple factors involved, not just a triangle. Okay. So this leads to the multiple factors for causing illness. Like for example, tuberculosis. It's just not due to tuberculosis, bacilli alone. A lot of other things, poverty, overcrowding, malnutrition, all this contribute to TB. Okay. So just by sitting next to somebody who's got TB in a train and traveling for 12 hours, you will not get the TB. But there are other factors like poverty, overcrowding, and malnutrition. Okay. So this is the agent, host, and environment, the same thing. Now let's look at this malaria. The agent is Plasmodium vivax, host is man, and the environment is stagnant water and breeding sites. Agreed? No doubt about this. Now again, dengue, man, mosquito breeding sites. Cholera, man, the bacilli, man and polluted water. Typhoid, again, the bacteria, polluted food and drink. Rabies, man, animal bite. Okay. So this is the way the epidemiological triad works for infectious diseases. Now, when does this multifactorial stuff come in? Let's take a look here. Somebody's got a heart attack. So, what are the factors? First is the stress, then the diet, then physical activity, rather lack of physical activity. Then some hereditary factors. Parents may be cardiac patients or grandparents. Then hypertension. Then you have, this leads to hardening of the arteries. Here again, hormones play a part. Smoking, blood clotting irregularities. Again, hardening of the arteries leading to heart attack and stroke. So we have multiple factors, not just one factor. Now, among these factors, which one is modifiable? What do you see here? Which one is modifiable? Which one is modifiable? Which we can prevent to some extent? Which one can you prevent to some extent? Can you prevent your heredity? You cannot prevent heredity, but what about the other things? Like, for example, diet, yes. Stress, yes. Physical activity, yes. Smoking, yes. Hormones, we cannot do very much. So these are the modifiable risk factors. The heredity is one thing which you cannot modify. Okay. Obesity, yes, you can go for a morning walk, morning run. Your things will go. So what can be prevented? Stress, diet, obesity, smoking, physical activity, hypertension, dyslipidemia, and diabetes. Okay. So these are things which, but what cannot be prevented is heredity. Then you have something called web of causation. What is a web? We're not talking about internet web, but what is a web? General web. What is the meaning of the word web? Before internet, what is the meaning of the word web? Which animal casts a web, you can say? Which animal or small animal has a web? Huh? Yeah, spider. Yeah, okay, spider. So spider's web. Okay. So here it's also called web of causation. Here you have, in the case of, this is a case of example of TB. Here you have a susceptible host. Remember the word susceptible host. It may not be you or me, but somebody who's likely to get it. So what is adding to it? Overcrowding, malnutrition, whether he's vaccinated or not, generic factors. Then comes the exposure to mycobacterium. So he's coming from a slum area where there's overcrowding, there's malnourished. He may not have taken the BCG vaccination. Very unlikely, of course. Genetic factors, maybe his father or mother may have had TB. Then he gets exposed to mycobacterium tuberculosis. Then he gets infected. Okay. Then comes the tuberculosis tissue invasion and reaction. So this is the web of causation as far as TB is concerned. Okay. So overcrowding, malnutrition, and vaccination are the three things which are there in this example of tuberculosis, which I just gave. Now come to the important thing, levels of prevention. Now this is something which, the question which is asked, you can answer this question for any question in community medicine. You can answer if you have some idea of this, levels of prevention. So you have three terms, primary, secondary, tertiary. You know the meanings of those, right? You know the meaning of primary, no? Yes or no? Primary school, secondary school, tertiary is third degree. The first one is the difficult one, primordial prevention. So let us go to that. So primordial, this is an example again. Primordial prevention actually prevents the development of risk factors. Risk factors. Primary prevention, here there is no disease. You are just preventing the appearance of risk factors. Primary prevention, on the other hand, is again you are trying to prevent the disease, risk factors have occurred. Secondary is the patient is already infected. You are trying to treat the patient. Tertiary is the person is treated and you are trying to make him better without too many complications. Okay. So, if you look at this, primordial prevention is before the occurrence of risk factors. Then you have onset of disease. At that time, he can be asymptomatic, or he can be, then little later becomes clinical. So during the clinical, you have this clinical diagnosis. And then the clinical course. Okay. Now, so here, primordial is a development of risk factors in a population group which they have not yet appeared. Special attention is given in preventing chronic disease. Main health intervention is health education. The efforts are dedicated towards discouraging people from adopting harmful lifestyle habits through individual and mass education. Now, this is very particularly important in childhood, where many people pick up habits fast. So you have to inculcate good habits in children, so that the risk factors may not occur. Like adults, many adult problems have their early origin in childhood, because it's a time when lifestyles are formed, like smoking, eating habits, physical exercise, nowadays junk food. So primordial prevention begins in childhood, when health risk behavior starts. Parents, teachers and peer groups are important for this primordial prevention. Examples of primordial prevention: food and nutrition, comprehensive health policies for discouraging alcohol and drugs, then promote physical activity, making major changes in lifestyle. So here, okay. Now, can you give some examples of primordial prevention? Let me see how you work. Let me see your brains working. Give some example of primordial prevention. Before the risk factor occurs, you're doing something which may help this. Anything? Any ideas?
Lifestyle change.
No, lifestyle change. What lifestyle change?
Food.
What food?
Healthy food.
Healthy food. Okay, he's saying healthy food. What else? Anything else? He's saying healthy food. He said lifestyle. Can you be a bit more specific? Can you give some example? Anybody? Avoid smoking and alcohol. Okay, it's written on the board. Anything else? Anything else? Regular? Regular balanced diet. Regular balanced diet. Okay, what else? Proper walking and exercise. Very good. So these are some of the changes. We're right. But one specific thing I was looking for, I thought you may give the answer. In school, KG class, or maybe even earlier, 2, 3 years, 4 years, what is being done? Children are taught to brush their teeth, right? What happens if they don't brush their teeth? What happens if they don't brush their teeth? Huh? What? Huh?
Hygiene and cleanliness.
In hygiene and cleanliness, what happens? If you don't brush your teeth for 2 days, what happens? Bacteria will come there, right? So that is something which children are taught. You brush your teeth. Okay. Similarly, wash your hands. These are small things which are there. Then, of course, physical activity. Now, if somebody said physical activity. Who said physical activity? Yeah. Nowadays, we had during our time, your time also, we had a period called physical activity, or physical training. Chilo ki chilo na? Now what is happening? Physical activity period is there, but children are watching mobiles. No physical activity. No games. Everybody is watching a game on mobile. For Manchester United, football, cricket. But no, they are not playing themselves. Okay, so this is something which is very important. Lack of exercise, proper diet, small habits like cleanliness, brushing your teeth. All this are important for primordial prevention. Is it clear? So basically, before introduce another important thing is when this lifestyle has changed such a lot in recent years. 2 years, a child of 2 years is also given a mobile phone. The child doesn't know, but the child is watching cartoons. The child is watching something else on YouTube. The child probably is even, after 5 years, the child may even order something on Zomato or something. So that is another way the child is not moving. The child just wants the mobile phone. Give me the mobile phone, otherwise I'll cry. So the child is crying. That is what's happening now. So you're getting the food also through the thing, somebody's paying for it, whatever it is. He's watching the thing through it. That is what's happening. So next is primary prevention. Action taken prior to the disease, which removes the possibility that the disease will ever occur. Actions are taken before the onset of disease. This includes intervention in the pre-pathogenesis phase of a disease or health problem. For example, primary prevention is basically health promotion and specific protection. Among the health promotion, health education, environmental modifications, nutritional interventions, lifestyle behavioral changes. On the other hand, specific protection includes immunization, chemoprophylaxis, use of specific nutrients, safety of drugs, and control of environmental hazards like air pollution. So you have two broad categories. One is health promotion, the other is specific protection. Health promotion is generally everybody is giving a bhashan. देश को ये बनाना है, वो बनाना है. But this one is specific. Immunization, chemoprophylaxis, use of specific nutrients, safety of drugs, control of environmental hazards, example, air pollution. So, for primary prevention, the WHO said two things. One is mass strategy or population strategy. The other one is high risk strategy. Now, mass strategy, what is the problem with the population strategy or mass strategy? What is the problem? What is the problem with the mass strategy? Tell me, sorry. What is the problem with the mass strategy? What is the problem with the high risk? And as compared to high risk strategy? Population mass strategy means you're doing something for the entire population. So what do you need for that? Yes, you need money and resources. Okay. Now, on the other hand, high risk strategy is the people at high risk. I'll give a small example. During our expo, medical expo here we had, one company came, Serum Institute of India. They wanted to have a vaccine for cervical cancer. Okay. So they have still, we are talking. So they want to do specifically for medical students. Okay. So medical students is a good idea, but if you take it to the entire population, they need resources. They don't have money. This one still we can manage. Some of you can pay, perhaps, maybe the management will pay, but that can work in a small, higher strategy. But for the mass thing, so you want to do it in the whole of Bolpur, you need money. Forget Bolpur, just in the nearby areas, you need a lot of money. So that's the difference between population strategy and high risk strategy. So population strategy is directed at the whole population. But here, for example, small reduction in the blood pressure would produce a large reduction in the incidence of cardiovascular disease. So if you organize a blood pressure screening camp, you give medicines to everybody, towards the end you will find that the heart attacks have reduced, cholesterol is reduced, blood pressure is also reduced. So again, that is not the only thing. You need lifestyle, behavioral and socioeconomic changes also. Now high risk is bring people at those only handling those who are at high risk. Say for example, your person is he's a hypertensive already. You want to check whether he's got a cardiac problem. You can do an ECG, you can do some studies to find out whether he's really got a problem. Or he's got a family history of heart attack. Screen him for hypertension, see whether he's a potential risk factor. That is called the high risk strategy. Preventive care to people at high risk. Okay. Then modes of intervention, we just talked about health promotion, specific protection. So health promotion, health education, environmental modification, lifestyle changes, and nutritional intervention. Specific protection is towards specific diseases, like for example, say usually vitamin deficiencies or some protein energy malnutrition cases. For that only we look at specific protection. Interventions, immunization, use of specific nutrients, chemoprophylaxis, protection against occupational hazards, protection against accidents, control of general environment, and avoidance of allergens. These are the interventions that we are talking about. So again, what is the immunization, your routine immunization, BCG, DPT, MMR, etc. Chemoprophylaxis for disease like cholera, leprosy, chloroquine. Use of specific nutrients, vitamin A for children, iron folic acid for pregnant women. Protection against accidents. Use of seat belt and helmet is also a specific protection, mind you. Protection against occupational hazards, avoidance of allergens. So these are all examples of interventions. Okay. Secondary prevention is, what is secondary prevention? The disease has occurred, you have come to diagnosis, but then what do you do next? You have to treat the person. So here, it halts the disease at its incipient stage and then prevents it from spreading further. For example, early diagnosis, screening test for breast cancer, breast self-examination, pap smear test, radiographic examination. Now in USA, for example, everybody who over the age of 50 has to go for a lot of tests just to find out whether the person is susceptible to cancer or something like that. So among the tests, you have a colonoscopy, you have a MRI of the chest and all that. Otherwise, the insurance will not pay for you. Okay. Then referrals. So objective of secondary prevention is to complete cure and prevent the progress of disease process, to prevent the spread of disease by curing all the known cases, to prevent complications and to shorten the period of disability. So then comes the early diagnosis. So early diagnosis, obviously, you need to diagnose the case early. Suppose, for example, a person is having fever for 5 days. You are just giving paracetamol, but you're not coming to diagnosis. So you come to diagnosis, do a lot of tests. It costs money, but do the tests. And then restore the health, treat the disease before irreversible pathological changes occur. So, you are giving a case of fever, high fever. You are giving paracetamol, fever is not coming down, patient is feeling weak. What can happen? What are the possibilities? What viral fever? The viral fever, okay, fine. What else? What else? The fever is there, you are giving paracetamol, fever is not coming down. What else could be there? Something could be dangerous. What? Huh? Malaria is one, what, something else related to malaria? Dengue, yes, exactly, dengue. So dengue is one thing which can suddenly come. So unless you diagnose it fast, the platelets may drop and he may need blood transfusion, but you do not know that this is dropped. So you need to test it, okay, and reverse the communicability of infectious disease. Tertiary prevention is when everything is over. The disease has come, everything is diagnosed. Here, you are using all your measures to reduce or limit impairments and disabilities and to promote the patient's adjustment to irremediable conditions. Intervention that should be accomplished is disability limitation rehabilitation, intervention in late pathogenesis. For example, somebody with a diabetic foot hai kyun hai? What happens in a diabetic foot? What can happen in a diabetic foot? What can happen in a diabetic foot? Huh? Paresthesia. No, how can progress further? Gangrene. Then what happens after gangrene? Amputation. Okay. So after amputation, what does the person need? Process. What else? Other process? You're right. Process is fine. What else? He may need a wheelchair. Okay. So wheelchair and process that person need. So you know he's got diabetes. He's got gangrene, amputated. Now he needs a process or a wheelchair. So here you have 4 other terms: disease, impairment, disability and handicap. Disease we know, impairment, disability and handicap, 3 different terms, slightly confusing. Disability is again limitation. Impairment is any loss or abnormality of psychological, physiological, anatomic structure. Disability is any lack of ability to do something. Okay. So suppose somebody was a good footballer, but now his leg is amputated. So that is a disability. Handicap is disadvantage for any individual resulting from impairment or disability that limits or prevents the fulfillment of a role that is normal for the individual. So this is confusing. I know it's confusing. Impairment, disability, handicap. So you have an accident here on the left side, impairment on the right side, loss of an anatomical structure. Then comes left side again, the lack of ability to perform an activity. What is the activity? He cannot use his hands. Handicap prevents fulfillment of normal role. Is this clear? Is it clear to some extent? Accident, after an accident, what happens is loss of an anatomical structure. He has lost his toe here. As a result, he has to go in a wheelchair. And then again, the handicap prevents fulfillment of normal functions. Okay. Then again, dental caries. Impairment is loss of tooth and disability, he can't talk. When he's talking, it's not clear. And as a result of which, he cannot socialize. Somebody doesn't have teeth, he normally doesn't socialize the way you and me do. So this is an example of, again, impairment, disability and handicap. Then comes rehabilitation. So after all this, we need some rehabilitation. The person is sick, he's become normal, to bring him back to life, you need combined use of medical, social, educational, vocational measures for training and retraining the individual to the highest possible level of functional ability. This requires cooperation from different sections of society. So what all is rehabilitation do you need? Medical rehabilitation, vocational rehabilitation, social rehabilitation and psychological rehabilitation. Medical rehabilitation is basically restoration of normal function as much as possible. Say this guy has had a stroke, then he's put into physiotherapy. That will be an example of medical rehabilitation. Vocational rehabilitation, restoration of the capacity to earn a livelihood. So this person is working somewhere, but he's lost his foot. So his source of income is gone. So he needs something to work. Maybe he can get a stall, he can get a lottery tickets or something like that. Social rehabilitation, restoration of family and social relationship. This is important, and as well as psychological rehabilitation, restoration of personal dignity and confidence. Can you name one disease which the last two things is important? One disease, maybe two diseases in which the last two things are important. That is social rehabilitation and psychological rehabilitation. Any disease in which social rehabilitation and psychological rehabilitation are important. Huh? What? What do you say? Stress and anxiety is not a disease, it's a symptom. I want to name a disease in which social rehabilitation is important. Anybody? Anybody? Huh? Autism is a very good answer is given. Autism is a present thing. So nowadays, if somebody says your child is autistic, that family is devastated. Okay. So that is what is called psychological and social rehabilitation. Earlier, another disease was there, also starting with A. What is it? You said autism. There was an earlier disease, also starting with the letter A, which was another problem 20 years back, 30 years back. What was the key? AIDS. So if somebody had AIDS, it became a social problem. People would not go to his house, he would be isolated, all this, there was a stigma. Same thing, psychological rehabilitation. Okay. Nowadays you have many people who have diagnosed with autism, many are leading a normal life, and now it is coming to the open. In the open meaning, people are not afraid or reluctant to talk about it. Like one of my former colleagues in WHO, she posted in a TEDx video. I didn't know about that, in fact. Her son is autistic. Her son is 14 years, but he's autistic, and as autistic children, he's good in music. But his parents realized that, both of them doctors, they realized that he's autistic only much later, when he was going to school and all. So, but she's come out publicly. So, autism is no longer it's a taboo or something, like what AIDS was in the past. So, this is social rehabilitation and psychological rehabilitation. Examples of rehabilitation: establishing schools for the blind, exercises in neurological disorders, prosthetic restoration of tooth. You said process for leg, right? Yeah, so process for tooth, reconstructive surgery in leprosy, and change of profession for a more suitable one, and modification of lifestyle in the case of TB. For example, a person who's got TB, he's working in a BD factory. What would you suggest? He's working in Murshidabad in a BD factory. BD banache. A lady who's got TB, she's making BD in the factory. What will you suggest? Huh? Wear a mask. She's already got TB. What will the mask do? She's working in the TB. She's making BDs. Huh? What will you advise? Huh? No, she's not smoking. She's making the BD. No, what else can you advise? What else you can advise? Tell me. Bolo. Achha, I'll give you another example. Forget about this lady in Murshidabad. Another TB patient, he's bus conductor in Kolkata. What advice will you give? TB patient, bus conductor in Kolkata. Keep going. Bus conductor ache. Keep going. What will you say? Simple answer. কিছু করবে না আইসোলেট করতে হবে ঠিক আছে আর তার আগে কি করতে হবে চলছে চলবে চিকিৎসা তো চলছে আর কি করতে হবে tell both of these people to look for a better job give them alternate job ঠিক আছে this lady who's making BD she's exposed to all the allergy and যে বাসে চালাচ্ছে conductor he's getting in contact with hundreds of people every day so that is another thing change of profession for a more suitable one so here the principles of rehabilitation are enable timely recovery, re-stabilize, retrain, re-motivate, re-socialize and reintegrate. ठीक है जी? So now can you tell me levels of prevention in COVID? What levels of prevention could be possible in COVID? Bolo. When COVID occurred you were in class 7 or 8, right? Huh? So then what level, what type of prevention? Huh? No, go step by step. What level of prevention? Primordial prevention, is it possible? Why not? Because the agent came from somewhere we don't know. Then comes what? After primordial prevention? Huh? Primary ki karo? What will you do in primary prevention? Huh? Primary prevention? Health education, specific protection. Right? So what health education did you give in COVID? Social distancing, wear a mask, specific protection. What is specific protection? What is the specific protection for COVID? Huh? That is your health education. Specific protection, okay, maintain distance, infected people. What else? Vaccination, okay. Secondary prevention is, what is secondary prevention? Secondary prevention is early diagnosis and treatment, and tertiary prevention is after the case occurred, people are still having long COVID and all these things. So that is how levels of prevention in COVID. Okay, so there's no primordial prevention in COVID. Now somebody mentioned Nipah. Okay, what is Nipah? Okay, so what is the levels of prevention in Nipah in West Bengal? Bolo. Primordial prevention, is it possible? You don't think so? Okay. Primary prevention, is it possible?
Primary, yeah, it is possible.
How?
To stay away from fruits and jaggery.
To stay away from fruits. She's saying to stay away from fruits. Tell breakfast kola khabe na. She's saying stay away from fruits. She's right to some extent. What else? Jaggery and what? Khejur ras. Okay. Okay, fine. So primary, stay away from that. Secondary prevention is take treatment. Okay. And tertiary is, of course, you try to rehabilitate the person. As a matter of fact, I think one nurse is better, the other one is still in the ventilator. Almost 4-5 days. So this is a level of prevention. So now you have an idea of levels of prevention, right? How you, for any disease, primordial prevention is one thing. Primary, secondary, tertiary, we can do it. Okay. So that's all. Thank you very much.